What can you do about atherosclerosis? Now, each year, more than 18 million people worldwide die of cardiovascular disease. And for decades, it has been understood that the major cause of cardiovascular disease is a condition called atherosclerosis, which leads to obstruction of blood flow to parts of the body, results in cardiovascular conditions, including heart attacks, heart failure, and strokes. So going back to 1980, pharmaceuticals brought a great breakthrough in the treatment of cardiovascular disease in the form of statins, a drug that drastically reduced cholesterol levels, which mainstream medical experts considered the sole cause of atherosclerosis. And since then, more people are dying from heart attacks due to the heavy usage of statins. Now, looking back in the past 10 plus years, the greatest increase in heart failure rates has been in the early 20s to 40 years of age. And there are many reasons for this terrifying statistics, as our lifestyle diets are high in omega-6 oils, sugar, specifically high fructose corn syrup, trans fats, toxic food additives, especially MSG, and processed foods. Other factors, of course, play a role as well, including inactivity, smoking, including vaping, drug abuse, and use of statin drugs. Continue watching till the end, as I will share supplements to reduce inflammation and to strengthen your heart. We know for a fact that the primary cause of atherosclerosis is linked to inflammation. And the key oil linked to atherosclerosis is not cholesterol or saturated fat eating, but the very class of oils that were recommended by doctors to lower risk: omega-6 vegetable oils, seed oils such as corn, peanut, and soybean oils. The reason is that all vegetable oils are polyunsaturated, meaning they are very easily oxidized. And oxidized oils are highly inflammatory, meaning they damage the walls of arteries, which results in formation of plaque. Canola oil initially gained acceptance because it contained a relatively high concentration of omega-3 fatty acids. Unfortunately, it's a poor choice for cooking or adding to processed foods because it also contains significant amount of omega-6 fatty acids. And omega-6 content, when used as cooking oil, canola becomes highly oxidized and contributes to atherosclerosis. And when added to processed foods or used as a salad dressing, it oxidizes when exposed to air. And the omega-3 oils are highly unsaturated and should not be used for cooking. Now, they reduce inflammation, improve blood flow, and reduce atherosclerosis only when consumed directly from wild fish, not from a man-made lab so-called vegetable oils. High intake of sugar, especially in the form of high fructose corn syrup, also accelerates atherosclerosis far more powerfully than cholesterol, and therefore is more likely to cause plaque buildup. And we have seen sugar consumption increase dramatically around the time we began to see a higher incidence of heart attacks and strokes in many countries. Statin cause foggy brain, causing major cravings for sugar. So let's dive deeper into the inflammatory mechanism behind atherosclerosis. Now, we know that any oxidized oil except DHA can cause atherosclerosis to develop. Oxidized cholesterol can trigger inflammation in the wall of the arteries and produce plaque. Unoxidized cholesterol does not seem to cause changes. It turns out that just as many people with normal cholesterol levels have a heart attack as those with higher levels. Here are things to trigger inflammation in arteries. You have radiation exposure, polyunsaturated vegetable oils, sugars, stress, injuries to blood vessels, toxic metals, MSG and homocysteine, diabetes. In blood testing, high numbers of particles and ApoB100 and ApoB48 levels occur due to inflammation. Now, diabetes is an excellent example of this inflammatory mechanism because we know that the blood of diabetics contains very high levels of free radicals and lipid peroxidation product. These caustic substances damage a thin layer of cells within the arteries called the endothelium. Diabetics are 4 times more likely to suffer a heart attack and twice as likely to have a stroke, and are 5 times more likely to have erectile dysfunction. In addition, they often suffer from hypertension and insulin resistance, as well as having abnormal blood lipids. This is a major metabolic dysfunction. In addition, they also have higher indicators of inflammation, hsCRP, and their levels of lipoprotein small a are twice as high, and statins have no effect on Lp(a) levels. If anything, we've seen an increase from using statins. So the question is, how do we stabilize plaque? So the pus made up of white blood cells and proteinaceous fluid that constitutes plaque is enclosed in a dense fibrous capsule. Now think of it like a pimple ready to burst. As the plaque grows, the outer part will become very thin and eventually rupture, spilling the pus into the inside of the blood vessel. When this happens, it will trigger the blood clot, causing a heart attack or stroke. And there are 2 basic ways to stabilize plaque. One is to strengthen the fibrous capsule, protecting the plaque from rupturing. Second, reducing the inflammation within the plaque will cause it to shrink and cool down. And to accomplish both of these measures, you can take vitamin C in a dose of 2,000 milligrams 3 to 4 times a day with food or empty stomach. Vitamin E complex, vitamin A with EPA from cod liver oil, and as for food intake, highest protection comes from blueberries, blackberries, and raspberries. Quercetin also has a powerful anti-inflammatory effects in dose of 200 milligrams twice a day with meals. Magnesium, grapeseed extract, and magnesium will both strengthen the fibrous cap and cool down the inflammation within the plaque. Dose is 250 milligrams to 3 times a day with meals. So more tips to strengthen your heart naturally. All the things I will suggest for reducing atherosclerosis will also strengthen and protect the heart. 1. D-ribose in a dose of 5 grams taken 3 times a day with meals. 2. L-carnitine, tartrate or acetyl in dose of 1000 milligrams 3 times a day, 30 minutes before meals. 3. B-complex vitamins. 4. Vitamin C, 2000 milligrams 3 to 4 times a day. 5. Niacin flush in a dose of 500 milligrams 2 to 3 times a day at a saturation level. Vitamin E complex, mixed tocotrienols 400 IUs 1 to 2 times a day. 7. Coenzyme Q10 ubiquinol 300 milligrams to 600 milligrams 3 times a day with meals. 8. Hawthorn extract 500 milligrams 3 times a day. Taurine reduces arrhythmia 1000 milligrams 3 times a day 20 minutes before meals. Could uptake up to 9 grams daily. 10. Basilin, especially for hypertensive heart failure. 11. Bacopa 250 milligrams twice a day with food to improve blood flow and heart arteries. And 12. Magnesium 200 milligrams of chloride up to 1200 milligrams daily, consumed every 2 to 3 hours to saturate your cells. 13. Nitrate supplement converting to nitric oxide to prevent anything from sticking to the arterial system while reducing inflammation and strengthening the capsule. As you can see, there are a number of things you can do to protect yourself from heart disease and atherosclerosis. In addition, maintaining delicate iron balance, as excess iron accumulation in the blood and tissues can actually be very dangerous and is associated with a number of adverse conditions, including heart attacks, strokes, and accelerated atherosclerosis and cancer.